This presentation is from a patient within the CVICU. The patient is a 4-month-old male with trisomy 21, complete AV canal unrepaired, and severe bronchiomalacia. A trach was placed back in January. Admitted beginning of January for respiratory failure, and the patient now resides in the CVICU. The patient's weight is 5.5 kilograms. Significant events overnight: the patient received 2 PRNs, morphine and Ativan for desaturation, down to the 20s. AT3 level was drawn for anti-10A level of 0.22, AT3 level was 56, and a one-time replacement was ordered. Physical exam findings include the following. From a respiratory standpoint, the patient is trached and on a ventilator setting of SIMV, PRVC, and nitric of 5, tidal volume of 50, PEEP of 12, rate of 40, pressure support of 12, and FiO2 at 100%. The respiratory rate ranges from 12 to 40, with saturations between 87 and 93%, and end titles between 52 and 58. The VBG this morning revealed that the patient is in compensated respiratory acidosis with a lactic level of 0.4. The chest x-ray this morning revealed an increased amount of atelectasis compared to yesterday's. From a cardiac standpoint, the patient has a murmur. Heart rate ranges between 118 to 139. The blood pressure 83 to 110 over 54 to 64 with a MAP of 60 to 71. The CVP ranges 15 to 25. Renal NIRS range between 62 to 71 and cerebral NIRS 64 to 71. The patient is on the milrinone drip of 0.25. From an FENGI standpoint, the patient has a net balance positive of 323 for the past 24 hours, and the patient's urine output is 4 kilograms per hour. Patient is on Lasix Q8 and Diarrhea Q-Day, Miralax Q-Day, Colace, and Pepcid Q-Day. The patient is on a diet of Alimentum, 26 kcal, and is at a goal rate of 24 per hour. From a heme ID standpoint, the patient was afebrile overnight, and the BNP and CBC show nothing remarkable, everything within normal range. Patient's anti-10A level this morning was 0.22, therapeutic goal is 0.3 to 0.7. An AT3 level was drawn and was 56, and a dose of AT3 was ordered and given. From a neuro standpoint, the patient has been very irritable. He's on the following drips: Dex of 1.4, Versed of 0.16, morphine of 0.26, and are on an auto wean every 12 hours, alternating every 6 hours of which medication to wean. Pharmacy has created the schedule. The patient is on a scheduled doses of methadone, Ativan, clonidine, and risperidone, and has the following PRNs available: morphine, Ativan, Tylenol, Benadryl, and Vec. Again, this patient is a 4-month-old male with trisomy 21, complete AV canal unrepaired, and severe bronchiomalacia who had a trach placed back in January. The problem list of this patient includes health maintenance, bronchiomalacia, trisomy 21, complete AV canal unrepaired, compensated respiratory acidosis, hypoxemia, subtherapeutic range of heparin, irritability, malnutrition, abdominal distension, and fluid retention. Differential diagnosis include respiratory failure, pulmonary hypertension, bronchiomalacia, complete AV canal unrepaired, and respiratory failure, which I already said. The plan is this patient is a 4-month-old male with trisomy 21, complete AV canal unrepaired, and severe bronchiomalacia, with a trach placed back in January. From a respiratory standpoint, we are going to keep the ventilator settings as is and continue to monitor the rate, oxygen saturations, and get another VBG tomorrow morning. From a cardiac standpoint, we are going to continue milrinone of 0.25. From an FENGI standpoint, we are going to give one-time dose of albumin and increase Lasix to Q6 hours, with a net fluid balance goal of negative 200 to 0 for the next 24 hours. Continue feeds as is. From a heme ID standpoint, we will redraw an anti-10A level in 4 hours to see if we are back in therapeutic range after the adjustment of the dose and the replacement of the AT3. From a neuro standpoint, we will continue with weaning the drips of Dex and Versed as ordered, and we will continue the scheduled medications. PRNs are available if needed, and that is the plan for this patient today. In the meantime, I'm going to consult CT surgery to get the timeline of the AV count repair for this patient. My consult includes: patient is a 4-month-old male with trisomy 21, complete AV canal unrepaired, and severe bronchiomalacia, trach placed back in January. The patient is struggling with maintaining saturations despite adjustments of ventilator settings and adding nitric. Patient desaturates multiple times a shift, requires multiple PRNs, and our team is trying to get an estimate of when you're able to take him to surgery to repair his AV canal. If you could please get back to us, that would be fantastic. This concludes my presentation and consult.